Jim, as a student of history, I know that it takes sometimes the right person at the right time in the right place to make miracles happen. And that's what you've done as the leader that caused and dreamed and then made happen moving pediatric CV surgery to Children's of Alabama. So my friend, thank you for a very great work and from a very grateful Children's of Alabama.
Hi, Dr. Kirklin. I think I speak for all the nurses when I tell you how much we value your respect for the bedside nurse's clinical judgment and skills. And you demonstrate this every day when you call in early in the morning and you ask to speak to the bedside nurse to find out how your patient was doing overnight. You could talk to the physician or the nurse practitioner, but you always choose to speak to the bedside nurse. And this makes us think how much you value our opinion. You're always a professional. It doesn't matter how little sleep you've had the night before, but you always act like a professional at the bedside, and you're always approachable. Your vocabulary is incredible. I remember early on when I first started attending CATH conference, I needed to write down the vocabulary words you used, particularly the ones I didn't know, of course, which I remember the first one you ever used was serpiginous. And you talked about a serpiginous artery, and I remember asking people around me what that word meant, and no one knew, but I still remember that word. I want to thank you for stopping the use of peroxide. I know it was painful for you to stop using peroxide to clean your incisions, but you were willing to change, and we've now moved forward and gone to chlorhexidine. We're going to miss you at the bedside.
Thank you, Dr. Kirklin.
Dr. Kirklin, buongiorno. It's been a pleasure and honor to work with you over the past 30 years. We've spent so many nights together doing transplants, and I just want to express my sincere gratitude for the collegiality and confidence you've shown to me in the perfusion department over the years. Your collegiality because you're always been my superior, yet always asking our opinions on matters of clinical practice, and yet your confidence allowing me to push the boundaries in the perfusion department and to optimize patient care and research and clinical practice. Without your leadership in this practice and the care of mechanical circulatory support, I would not have the recognition that I have accompanied in the perfusion field today. And I know that your father is so proud of your vision and perseverance to finalize this single platform of care for the Children's of Alabama. I just want to again express my sincere gratitude, and we will miss you in the operating room, but yet I will look forward to doing more research with you over the years. I wish you another cent'anni, another 100 years for you.
I hope everyone, including Jim Kirklin, can indulge me in reminiscing for a bit. I arrived at UAB in 1993, and I joined only 2 cardiologists who were putting in a Herculean effort just to do the daily work and keep the program going. It just so happened that about that time, we needed help forming a transplant program. The transplant program had already started, but they needed additional manpower, and so it was requested that I help out with that. And the program was successful. We had some good successes in the early years, but we had some heartbreaking losses on smaller children who just could not wait long enough to successfully have a transplant. We adapted some larger circulatory support devices from adults for larger children, but for small children there were no options. In the early 2000s, we began to read in journals about a device being used in Europe called a Berlin heart. It was essentially a miniaturized adult left ventricular assist device. So we talked about it together, and Dr. Kirklin, you'll remember that we spent many hours trying to figure out if this would work and whether it was something that we should try, and I remember that we agreed that we should because we didn't want the heartbreaking experience again of losing a child on the list. So in the mid-2000s, beginning around 2005, we started doing some Berlin heart implants. And I remember from those days that you couldn't just get a Berlin heart from Central Supply in the hospital. The devices had to be flown in from Germany, and they were flown in with a special team of technicians and perfusionists that would assist in the implant. Well, we had about 4 or 5 implants in the early days, and they all went very well, with all the children either successfully being transplanted or even recovering and having their device removed, and every one of the children was discharged home. So early in this experience, I asked the Berlin Heart team how they felt we were doing, because it looked like it was pretty good to me, although it looked like we were sort of making it up as we went a little bit. And they said, "Are you kidding?" They praised the surgical skill that went on in the operating room. They praised the camaraderie of the teams between medical, surgical, and ICU, and they told us it was that they were completely pleased with how things went at UAB. So these kinds of experiences that we had in the early days helped to lay the foundation for the program that we've built, the program that we now all work in. And it goes without saying that I admire Dr. Kirklin. He provided so much, including the surgical skill involved in the implants. He provided the willingness to work hard at bad hours. I've even seen the man cancel vacations. He provided leadership and training for many of the people who still work at the bedside in our program today. And his research efforts generated new knowledge and raised the profile of our program. So I hope everyone present tonight can join me in honoring my friend and colleague Jim Kirklin for his ongoing contributions and for a lifetime of achievement.
Dr. Kirklin, no one can appreciate such a long, outstanding career in such a short minute, but I'm going to go straight to the heart. I love you, and Stephanie loves you. I admire you, and I'm so happy you're going to be getting a little R&R, rest and research. I thank you for being such a marvelous example of what a true surgeon really is. I've known you over the years to be a good steward of every gift and talent that God has given you, and you have multiplied them many, many folds. Your quiet sacrifice of serving and saving others, always putting the patient first, I've known from day one. And everyone knows of your unwavering, ageless, never give up stamina that no one will ever match. I can remember after many all-nighters of ECMO and LVAD and re-entry, the next day you'd say, "It was fine." And I just, as an RNFA and a scrub nurse, want to thank you for everything that you taught me. I want to thank you for every kindness. And personally, I want to thank you for all your help and advice with my own cardiac challenge family. I just want to say, may God bless you. May He fill you and refresh you in every place that you've emptied yourself out in your whole life as a true surgeon. I love you. I will truly miss you. Please take care.
Dr. Kirklin, I just wish to thank you for the many years of your support that you've given me, all the way from being a resident and then a junior faculty and now to being a mid-career faculty. You've been nothing but a huge support, nothing but a great mentor, somebody that I can really come to with my questions regarding the patients and their care and their management. And you've always had excellent advice and wisdom on the topic. I appreciate what you mean to Birmingham, Alabama, to our Heart Center here, the national recognition that you bring us and that you've catapulted us to becoming such a great center. I really do thank you personally for letting me be a part of that over these past 15 years. Thank you so much.
Hey Jim, I'm glad that I could be a part of this conversation today. As a young physician and being part of this center, I just want to thank you for all you've built in this center today and that we all have a great opportunity to work in. When I reflect back over the last few weeks, I've learned much about the history and how your family's contributed to the development of the specialty, which we all know very well. And when I think about you specifically, especially within our group of 3 and now 4 surgeons, I think what is unique about Jim and the OR and all the times we spent together doing cases and long nights through transplants. And I guess the most unique thing I can think of is that you can move your own bed. And Jim, I just thank you for that and teaching those concepts to our young surgeons. And I hope maybe in the future one day we could have other young surgeons who can do that. But in all seriousness, Jim, I wish you all the best as you go through this transition and look forward to working with you more on some of our academic endeavors. All the best.
Thank you, Dr. Kirklin.
When I got out of nursing school in 2004 and was offered the job in CVOR, I am so grateful that I took the opportunity to learn to scrub with you, and that throughout the next couple years you took the time and patience to teach me how to be a good scrub nurse. I am grateful for those moments that you were really hard on me, because that pushed me to be better at what I do. And I feel so privileged that I was able to work beside you and witness a portion, even a small part, of this amazing legacy that you've created. I really appreciate all the time that you took training me, and I'm so grateful for the moments that we've had in the operating room, just for me being able to learn so much. It has been an honor working with you, and I'm really going to miss you in the operating room. I honestly did not see myself here 12 years later working in cardiac surgery when I started my career, but I'm so grateful that I learned through you that I love this job and it's truly my passion, and that's because of you. So thank you very much, and I hope you enjoy this much deserved season of rest.
Hi Jim, it's been 35 years. Can't believe it's been that long. But I just want to say thank you for making me better at my craft. And thank you from all the hundreds, probably thousands of patients who are walking this earth today, because you would never give up on them. Your tenacity and your strength and your endurance is something that we've all respected since we started working here. And we just thank you very much for everything you've done for this institution, and wish you well in your research endeavors, and hope to work with you again at that point. Thank you very much.
This last decade has been a very exciting time for me, and it really started in 2006 when Jim Kirklin became the Division Director of Cardiothoracic Surgery. We took what was a very nascent neonatal program all the way to one that we're all very proud of, and in reality is a top-notch program that can be seen throughout the world. All through this time, he has been a wonderful advocate of what we needed. The last 10 years, he has been able to take issues as they've come up, and the thing that I've always appreciated about Jim was his optimism. Whenever we hit a roadblock or an issue, he would quickly assess the situation and then would pivot over into what he called problem-solving mode, which then would then give the impression and the optimism that this was something that we could handle and something that we could overcome. When he became division director, a major area of his focus was pediatric and congenital heart disease, and that support meant getting us space in the very busy ICU, recruiting very expert surgeons, and also supporting the formation of a cardiac intensive care team that could take care of these very sick children. He has been very far-sighted in his vision of this platform of care. And really this platform of care provides a very tangible and lasting structure that will allow us to care for patients with congenital heart disease all the way from fetus to old age. He advocated for it so eloquently that he was able to change the floor plan of the 5th floor of the Women and Infants Hospital even after it had all been planned. He advocated before the Joint Leadership Board and before the Children's Hospital Leadership and UAB and made it all happen. And so many times now as I cross the bridge from our cardiac floor here at Children's and the doors open to the women and infants and I look down this hallway, this corridor that's beautifully sunlit, I think about the vision that has come to fruition that Jim advocated for us. So thank you, Jim, for your care of the individual patients that we have shared over the last 20 years and all the lives that you've made better. Thank you for your decades of enlarging and refining our knowledge base in the care of these patients, both locally here in Birmingham and Alabama, and also really throughout our community throughout the world. And thank you for bringing that vision that you advocated for to fruition. I really look forward to the contributions that you will make in your next phase of life as you concentrate on data and tell us how to do things better.
Hi, Jim. Your father used to say it's all in the details, and he was really, at that time, he was really talking about the setup, the surgery setup, and how you would look at every minute thing and make sure you had everything for the case. And you know, that saying has gone a long way in my life, and you can apply it to a lot of different situations. And you probably won't remember this detail, but I remember one time when you were a fellow at UAB, and I was scrubbing a case with your dad, and you were watching over his shoulder. And it was a really difficult, complex case, and I was, I don't remember exactly what was going on at the moment, but I was doing my best to keep up and focus and give him everything that he needed. And for some reason, I had gotten upset, and I was just trying to hold it together. And I glanced over at you, and you winked at me, and that I lost it at that point. But that just showed me how much compassion that you have, and your intuition on how I was feeling at that moment. And I think that detail has carried over into the care of your patients, your compassion and your attention to detail, no matter how long the case or how difficult, and your ability to just keep on going and always focusing on the care of the patient. And that has meant so much to me. And I am truly honored that I have been able to share this journey with you. You and your dad have meant the world to me in my life, and continue to, guide my life and my career. So I wish you all the best. And again, thank you so much from the bottom of my heart.
Dr. Kirklin, Jim, I thank you for your service and mentorship over the years. I use the term Dr. Kirklin as my esteemed colleague, world famous surgeon and researcher, and I use the word Jim as good friend and confidant. Jim, we thank you, and all my patients thank you for your great efforts over the years. So in the words of a former Dr. Kirklin, there's no room for fear in a surgeon. And at the same time, you've been the embodiment of no fear in a surgeon. You've exemplified the careful and considered approach to the most difficult congenital heart lesions. And my patients every day in my clinic, my pediatric and adult congenital heart clinics, are testimony to your skill and care. Thank you.
We love you, Dr. Kirklin!
Hey, Dr. Kirklin, my name is Jace Proctor, and you operated on me in 94, 95. I had transposition of the great arteries. I am currently a student at Auburn University, and me and my family would just like to tell you how much we appreciate you.
Yes, Dr. Kirklin. We are very grateful and thankful for all that you did for Jace and the care that he received while he was your patient. The one thing that I remember and will never forget is you were the first person that we saw when we arrived to Jace, and you were sitting at his bedside, and that just means the world to terrified parents who does not know for the unknown, because at that time we didn't know, and you were there, and it was very comforting, and we are forever indebted for everything that you did for Jace and the care that he received. So thank you from the Proctor family. We just appreciate you and wish you the best, and congratulations on a wonderful career, and we are very blessed to have received your care and been a patient. Jace, have our child. been under your care. So thank you.
When you reflect on the career of somebody as famous as Jim Kirklin, the list of his accomplishments is quite extensive. He obviously is an outstanding surgeon and has touched and saved so many lives over the course of his career. He is one of the leading heart transplant surgeons in the world and has contributed more to research in that field than any person that I can think of. He's a past president of the International Society of Heart and Lung Transplantation, and he was a longtime editor of the Journal of the ISHLT. The list really goes on and on and on. But in my mind, there really is one accomplishment that stands out at the very top of that list, and that is recruiting me to his faculty. Okay, so that's probably not the greatest thing that he did, but what clearly is the ultimate contribution that he has made to the field is bringing the congenital heart surgery program from UAB to Children's of Alabama. In the mid-2000s, Dr. Kirklin recognized that while the pediatric cardiac surgical patients at UAB were getting great care, it just didn't make sense that almost 50 babies a year were getting on a plane and flying to Boston where they were having surgery at Boston Children's Hospital. So Dr. Kirklin developed a plan to reinitiate the neonatal surgery program at UAB. He recognized the immense resources required to create such a program, and he worked tirelessly to build a bigger and better team to take care of all of these very complex babies. And most importantly, he made the decision that to be a preeminent program, there had to be a move to Children's of Alabama. While there were countless roadblocks and headaches that were involved in both the negotiations and the planning, Dr. Kirklin's vision of a comprehensive platform of congenital heart surgery was realized in October of 2012 with the grand opening of the Bruno Heart Center here at Children's of Alabama. There is no question in my mind that of all of your amazing accomplishments, Dr. Kirklin, this is the one that will go down as the single most important contribution to our field. Your vision has given all of us the opportunity to develop this place into one of the most outstanding congenital heart programs in the country. And you have opened new doors to assure that every baby born in Alabama with complex congenital heart disease has access to the best cardiac care possible. For that, Dr. Kirklin, I say thank you. Thank you from the bottom of my heart.
Thank you, Dr.